Let's consider Chapter 15, our chapter on the mental disorders, also called psychological disorders or psychological illnesses. This is a particularly valuable chapter because I can't imagine a person in this class not being personally touched by a mental disorder. You might suffer from a depression condition, anxiety condition, bulimia, so many different conditions, or a family member might have bipolar disorder or schizophrenia, alcoholism. You get the idea. It's impossible to live without being touched with these disorders, so it's a great idea to have a basic knowledge of some of the most common disorders, their causes, and in the next chapter we'll consider treatments because virtually every disorder is very treatable. Unfortunately, so many people see it as a sign of personal failing, and which it is not, and they don't reach out for help. And generally, most disorders tend not to go away on their own. So with this understanding, we'll be able to help ourselves and other people and hopefully live a much more satisfying and productive life. So let's start now. What broad terms should we use for these disorders? In the previous slide, I used psychological disorder, and that's a fully acceptable term, but you could also call these illnesses psychological illnesses, mental disorders, and mental illnesses. These all are health conditions, and these health conditions can negatively impact how we, three blanks. What do you think? If you're thinking think, feel, and act, absolutely correct. Be careful though, not every three blank answer will be think, act, and feel. It might be id-ego, superego, or if you consider developmental psychology, it'd be looking at how we change physically, intellectually, and socio-emotionally. But here, the correct sequence is, in any order, think, feel, and act. How are these disorders diagnosed? Well, with a manual called the DSM typically. DSM stands for Diagnostic and Statistical Manual. Diagnostic, of course, referring to the word diagnosis. Statistical is a little bit of a toughie. When I ask students on tests, what does the S stand for, I get all sorts of options, some of which I frankly like better than the word statistical. Many students want to go with symptom. Don't go with that word. Go with statistical. As you can see, it's produced by the APA. Many students would think, American Psychological Association. No, the acronym APA is used by many organizations. In this case, the P is for psychiatric. Now, this is not the only manual that's used. Another one that's as commonly used is produced by the World Health Organization, and they are very much compatible with each other. Let's jump into the different families of mental illness. We'll start with anxiety disorders. In this particular chapter, obviously, we won't have time to go through all the disorder classes, and not necessarily even every disorder found within a particular family, but we'll try to do a nice representative sample, including most of the ones that are discussed in intro psych and maybe a few beyond that. So let's again consider anxiety disorders, starting with one called generalized anxiety disorder. If you suffer from this one, you're in a constant, continuous state of anxiety when you get up throughout the day, when you go to bed. I often ask my students, name some things that make you feel anxious. Common answers are public speaking, the way you feel before a test, maybe driving on snowy roads. Well, I ask my students to imagine feeling that way that you feel in that circumstance most days, most of the day. It's very unpleasant, but thank goodness it is very treatable. Next, let's consider panic disorder. A person with panic disorder has an ongoing problem with panic attacks. If you have a panic attack then, do you have panic disorder? Not at all necessarily. For example, almost 40% of students will have a panic attack. Very few go on to actually have panic disorder. Invariably, many students in each class have already had a panic attack, so I ask the students to volunteer common symptoms. One common symptom is a racing heart. It often is confused with a heart attack. This is not to say that if you have the symptoms of a heart attack, you should dismiss them. I share the example from Dr. G Medical Examiner, in which a Vietnam vet had PTSD, And he ended up on Dr. G, Medical Examiner, which is a show about a coroner. It's never good to be featured on the show. And I asked my students to guess how this vet ended up on Dr. G. Well, he had not only PTSD, he had panic disorder. And he had not a panic attack, but a heart attack, but it felt the same to him, so he ignored the symptoms, and he actually died of a heart attack. So again, if you're the heart attack age, don't necessarily dismiss symptoms that are heart attack-like. Be careful of diagnosing yourself with panic disorder if you're of heart attack age. But in any case, feeling like you're having a heart attack is one symptom. Rapid breathing. With that goes a feeling that you can't get enough air. With rapid breathing and feeling like you're not getting enough air would also be many times tingling of the body. It might be all sorts of visual symptoms related to this hyperventilation, blurred vision, tunnel vision, black and white vision. Other symptoms include a feeling of sheer terror, a feeling like you're going to die, and many other symptoms as well. It's very intense, very strong. When it passes, the person feels exhausted, mentally exhausted, physically exhausted. Again, thank goodness it's treatable, but you have to seek treatment to get it treated. Next, let's consider phobias. I'll define them for us as an intense and irrational fear. If it's not intense, it's not a phobia. If it's not irrational, it's not a phobia. Next, go to the subsequent slide on phobias, and when you're done, come back to this slide because we still have to talk about OCD and hoarding. So we just defined phobia as an intense and irrational fear. It could be of an object, or it could be of a situation. At this point in the course, I introduced the concept of stigma every year. In the past, virtually every mental disorder had heavy stigma. You wouldn't share with friends. You would not necessarily share with family. You certainly wouldn't share with your employer or your neighbors. Virtually all mental illnesses had heavy stigma. For example, in the past, if you had an intellectually disabled child, you would have kept the child at home as much as possible, or maybe institutionalized the child for fear of embarrassment. Thank goodness we've changed. I'd like to talk about phobias because this mental illness has lost all or virtually all of its stigma, so students are comfortable sharing their phobias. If I asked you to share your phobia, would you have? Some of the common phobias that students share are heights, acrophobia, which you don't need to know the name, claustrophobia, tight closing places. You don't need that name either. Or look at the pictures on the slide, the snake, clowns, spiders, dogs, birds, needles, blood, public speaking, and so on. There's also less usual ones. I'd say birds are probably a less usual one, but it also could be things like lint or styrofoam. People with phobias can be a snob. My phobia, in other words, my intense and irrational fear is reasonable, but yours is ridiculous. Please don't be a phobia snob. There's no difference between being afraid of needles and perhaps being afraid of lint. They're equally phobic. Let's consider one phobia by name, agoraphobia. Almost everybody with agoraphobia has panic attacks, and they were untreated, and it morphed into agoraphobia. This is not to say that most people with panic disorder will develop agoraphobia. Definitely not. But just about everybody with agoraphobia started with panic disorder, which they did not properly address. I was lucky enough to travel one year to Greece, and while in Greece, I went to an agora. An agora is a marketplace, so literally it comes from the Greek phrase, fear the market. But it's not the marketplace per se, it's any place that you can't get out of easily and quickly, any place that is not considered safe by you, not within your safety zone. A person with a very light level might be able to go wherever they want, but it would be unpleasant, and maybe given a choice between going out to a movie or ordering one in, they would choose to order in. A person with more severe agoraphobia maybe could not leave their neighborhood, alone that is. Severe yet, maybe they could only leave their neighborhood with a trusted friend, relative, or family member. At the most severe level, the person would become literally housebound. So definitely all mental disorders should be treated. Next, let's consider OCD, obsessive compulsive disorder. We have to begin by distinguishing obsessions from compulsions. An obsession is a type of thought, whereas a compulsion is a type of behavior, but we have to add on more than that. So the obsession is a repeating thought that causes great anxiety. The compulsion, then, is the behavior that the person may feel compelled to do over and over. Why do they feel compelled to do the behavior? Well, while they're doing the behavior, it temporarily alleviates the anxiety. It's a short reprieve. So obsessive, the repeating thought; compulsion, the repeating behavior. Let's consider two examples. Probably the example that most people think of first is the obsession over germs, dirt, contamination. The behavior, excessive hand washing. That might actually be a healthy behavior for a short term in this environment, but long term, it is not. People with OCD might have to get up repeatedly during a class because they have to wash their hands. A person might get fired from their job because they're always in the bathroom, again, washing their hands. A friend of a friend had a baby that was actually hospitalized because she kept washing the child's hands with the antibacterial soap, and the child became very, very ill. Another obsession is to perform rituals. Let me rephrase that. To think about the rituals. The compulsion would be the performance of them. So obsession, the thought of the ritual; compulsion, the doing of it. For example, a person might have to flick a light switch 5 times when they enter a room. Obsessions often involve numbers. Maybe you cannot live at an even number house or an odd number house. Maybe you can't have an odd number channel listened to on your TV, or you won't listen to an odd number radio station. Again, these are two of the categories of obsessions and compulsions. There are many more, though. And if you take abnormal psych, you'll hear other categories as well. As you remember, hopefully, from the earlier slide, another category of anxiety disorder would be hoarding. This is a new category in the DSM. Hoarding can be of objects. Sometimes they're objects of value, but can be also objects with no value, rotten food, newspaper, plastic bags, used cans, or even human excrement, believe it or not. I'm sure we've all seen those TV shows about hoarders, and they're hard to resist watching for at least a few minutes. Sometimes the house is unsafe. If it ever caught fire, the person would definitely die and they would not be able to escape. Other times, the house actually has to be leveled because it is a public health menace. But let's consider the next slide, which is, I think, even more disturbing. Hoarding can be in objects, but hoarding can also be of living animals. Whenever you hear of a seizure on, say, the evening news, in which 20, 30, 40, 50, 60, 100 animals are seized, this person is a hoarder. Many times these animals are in terrible shape, sometimes found dead in their cages, cages often full with excrement, inches, or sadly these people have a mental illness which they are imposing on other living beings. As a hint, it's in the family of anxiety and OCD related disorders. Make your guess. The way they're dressed could be a possible hint. In trichotillomania, the person has an irresistible impulse to pull out their hair. It could be head, eyelashes, or really any part of the body. Since it's related to OCD and the other anxiety disorders, it's often treated with the same therapy and the same medications. Let's now consider family disorders called the paraphilias. They're all unusual and often unacceptable sexual preferences. Let's start with zoophilia. Any guesses? If you're thinking, no, it can't, yes, it can. This is people who sexually interact with animals. Necrophilia. Maybe you've heard the term necropolis. Necro refers to death, so necrophilia, they are aroused by death and dying. There are different levels of it, if you believe. A light level might be just a person imagines their partner is dead or a partner is dead. A more severe level, maybe they will, since these partners I assume are very hard to find, pay a sex worker to apply a little blue makeup and act dead. At the more severe end, maybe getting access to dead people and having sexual interactions. Or at the severest end, murdering people to have sex with them when they are dead. Next on our list, sadism. Named after a real historical figure. Do you know his name by any chance? He was the Marquis de Sade. He treated the prostitutes and women that he had sexual interactions with that were non-prostitutes in a very sadistic fashion. At a certain point, even though he was royalty, even the royalty drew a line and he was in prison and wrote his famous text there, Quills from Prison. So this person enjoys physically punishing and degrading their partners. Next, transvestism. Many students get transsexual mixed up with transvestism. They are very, very different. The transvestite, look at the vest, pay attention to the clothing, vest. This person gets sexually aroused when they dress in the so-called clothing of the opposite sex. So picture a man, since this is almost always a man, who gets aroused when he puts on, ladies say, undergarments. If you're thinking this person, he must be a gay man, absolutely, positively not. Almost all transvestites are heterosexual males. Often their partner does not know. And I joke with my classes, to the ladies anyway, if your lingerie is always stretched out, perhaps this person might be in your life. Next, let's consider the term fetishism. Though sometimes fetishism is related to transvestism, sometimes it's called fetishistic transvestism. That's a mouthful. But anyway, what is a fetishist? Who is the person with fetishism? He, and I'll say he because he is usually a he gets aroused by parts of the body that most people don't find sexual, such as hands or feet, or aroused by objects. And students will usually yell out shoes or other objects. And indeed, you are right. This person would have to have his female partner wearing typically high-heeled stilettos, or quite possibly he does not need a female partner at all. All he needs is the high-heeled shoes. I do have two stories that students have shared with me over the years on fetishism. One student said that she wore what she called her tip boots to her work as a bartender. And one day she was offered a very high amount of money, and I don't remember how much, to take her tip boots off, and she sold them on the spot and worked the rest of the night barefoot behind the bar. Another woman shared that she was knocked down and she was afraid that she was about to be sexually assaulted when the man merely stole her high-heeled new stilettos and made off with it. The student was very angry. She recounted the story, but I think it could have turned in a very different direction. So anyway, so two real-life stories of fetishism. Next, let's consider pedophilia. Many students say, feet. No, that's pod, like a podiatrist. Pod is feet. Ped is child. This is the child sexual predator. This person who has any form of sexual interaction with a child or with a minor who is too young to consent. Next one, frauderism. You're probably not familiar with that one. This person grinds up against strangers. In the old days, they used the term masher. If you watch an old-fashioned movie and the woman's yelling, masher, masher, she has just met a frauderist. Frauderists love crowds. For example, crowded subways, crowded trains, crowded buses. And as my students told me, crowded bars. Some of them have had this experience. Now let's consider the masochist. Maybe you've heard the term sadomasochism, perhaps? The masochist is the person who sexually enjoys being punished. They sexually enjoy being degraded. Many people go either way, and they are sadomasochists. Though other people are just sadists, and other people just masochists. Now let's consider exhibitionism. Look at the root word and see if you can guess the nickname. So exhibit, to show. What are they showing? So the nickname, the flasher. Though my students say it's more common, because apparently more than a few have met exhibitionists, that this is a man with a car that drives around a lot and gets lost a lot and stops to ask for directions, or goes through drive-ins a lot to order food, and the person realizes that the person who is asking the directions or purchasing the food is fully naked and often masturbating. Well, you have just met an exhibitionist. Now let's consider the voyeur. Can you think of the nickname for the voyeur? If you say peeping Tom, right on target, named after another real-life person. If you know the story of Lady Godiva, the people of a village were being oppressed. She won their freedom from oppression by agreeing to ride through the town naked. All the townspeople agreed to stay in and not look, except for one who peeked. His name, can you guess it? Tom. He was a peeping Tom. So this is not a complete list of paraphilias, but probably enough for our course. So take some time to learn the paraphilias, and when you think you're not bad at them, give this a try. When you're done, get the answers. Let's see how you did. The masochist, he or she enjoys being punished or degraded. Zoophilia, arousal related to animals. Pedophilia, ped referring to child. This is a person who desires sexual interaction with children or minors that are pre-consent age. Necrophilia, death, aroused by death and dying. Frauderist, the masher, likes to rub up against strangers. Sadist, like in the Marquis de Sade, likes to degrade or punish their sexual partner. Transvestism. Vest is an article of clothing. This person gets aroused by dressing in the clothing, particularly the undergarments, of the other sex, if we should use that term. Exhibitionist. What are they exhibiting? This would be the flasher. Fetishists. They're aroused by parts of the body or by objects. And again, parts of the body that most of us don't find sexual. Voyeur. The peeping Tom. How did you do? The previous DSM discussed PTSD in the anxiety disorder chapter. Now PTSD is considered to be a disorder of stress and trauma. I assume that you know what the letters stand for. They do indeed stand for post-traumatic stress disorder. This mental illness sometimes occurs after a trauma. Many people experience trauma. Not everybody will develop PTSD. I often ask people to ask what types of traumas come to mind first, and usually for most people, it's a soldier in a war situation. And that is a very good example, but I also ask my students to consider the innocent victims of war. They also experience PTSD. Or consider the people being displaced by, it could be war, it could be a famine or other societal pressures, but think of these people too when you think of traumas. Or if you consider the picture on the bottom, a person displaced by a natural disaster. There are common symptoms. Most people with PTSD are highly distractible, very easily distracted. They feel emotionally numb when they think of the event. They often re-experience the event. I ask my students not to think of flashbacks for this as a primary example. Flashbacks do occur, but that is not the typical or even common way to re-experience the event. I ask my students for suggestions, so take a moment and see if you can think of a way of re-experiencing a traumatic event without having a flashback occurring. If you said dreams, absolutely, as well as just constantly thinking about it. Every time that you perhaps was supposed to be attention to your task at work or school, you find your thoughts are on it. Sometimes there'll be an environmental trigger. The weather could be like the day of the tornado. The sounds, such as like popping of fireworks, could trigger. So it could be stimuli in the environment. or it could be continuously thinking about it. But again, flashbacks are very rare. Let's consider other common symptoms. One is anger. This is not recognized by the DSM, but I strongly suspect it will be in the next one. Some people with PTSD are very angry. Maybe angry at God, maybe angry at chance, angry at circumstance, angry that they survived and maybe a friend did not. But anger is very common. Trouble sleeping is very typical. Guilt, as I referenced before, survivor's guilt. And the person often startles very easily. I often take something and slam it in the class right now while students are taking the notes. And most people jump a little bit, but a person with PTSD jumps significantly. I try to avoid this in classes where somebody has identified to me that they have PTSD, of course.